Well, let's talk about where we are with the pandemic and where we might like to get to. I'm joined now by the Labour MP, Rushanara Ali, the Liberal Democrat MP and Chief Whip, Wendy Chamberlain, and also the Conservative MP, Sir Geoffrey Clifton-Brown. Good to see you all this evening. Thanks for taking the time to join us. Rushanara Ali, perhaps we can come to you first. Nearly 3,000 cases, we're now told, of the Indian variant, up from 2,300 on Monday. I know your constituency has had things pretty tough during this pandemic. How much of a concern is it for you and those in your part of the world, this Indian variant?
Well, it's a hugely concerning situation because constituencies like mine have suffered a very high death toll. We've got very severe levels of overcrowding, so people have really struggled with the lockdowns. And what we're seeing is, ever since this pandemic started, the government tends to be on the back foot. Even when the warning signs are there, and they were there, many of us warned the government to get the restrictions, travel restrictions in place, get control over our borders so that new variants didn't enter into the country. They've been falling short. You know, back at the end of March, we were asking questions, and early April, about the rationale for some countries being on the red list, but countries like India not being on the red list. And it doesn't make any sense, the rationale the government's followed. In fact, they kept saying they're following the science, but they didn't. And they keep repeating mistake after mistake. And it's then leading to uncertainty, damaging the economy and putting lives at risk.
And I know that you have seen surge testing a couple of weeks ago, I think, in your constituency with one of the other variants. I mean, are you expecting the same thing to happen with the Indian variant?
Well, look, whenever there are new variants, it's very important that government backs local authorities and local health providers with the resources and support immediately to do the surge testing. My local authority has had to find resources over the last year, which the government promised to provide. We have a £32 million shortfall. Many other local authorities in that position. The government needs to provide the resources so that can happen. We will need to do surge testing as we did before with new variants, and we need to make sure vaccines and the supply of vaccines are available for people to get vaccinated. I have a relatively young population, which means that we need to make sure we have access to the Pfizer and Moderna vaccines. Same applies to other areas that have got the Indian variant, like Bedford, as well, where the vaccine supply needs to be made available quickly to get to those who haven't been vaccinated, because that's one of the key ways in which we can protect people. We've done a great deal of work to make sure that take-up is equalised across different groups. So now we've got that. The Black community, we're doing more work on to increase their take-up. But this is not about people not taking up vaccines. It's because their turn hasn't come. And we need to make sure we fight the race against time to ensure everybody's vaccinated before this variant starts to take hold as well.
A point the Health Secretary made a little bit earlier. Wendy Chamberlain, perhaps we can turn to you. More tests and vaccinations being rolled out in Glasgow and Murray as well. Do you have faith in what the Health Secretary tonight called an incredibly sensitive biosecurity surveillance system? Do you feel that they are on top of this in those hotspots where the Indian variant's been found?
Well, I think when you think about what people are looking to get in relation to information, is we want a degree of certainty, we want clarity and consistency, and I think everybody accepts that the certainty one is very difficult for anybody to deliver because of the pandemic and the nature of variants, etc. But the government absolutely, and when I say the government, I mean the Scottish and UK governments, as well as the Welsh and Northern Ireland, have the opportunity to give that clarity and consistency. And from a UK government perspective, that has been missing to some degree. We've got confusion around the traffic light system. Obviously, in Scotland, we've ended up with a very similar traffic light system. I have constituents who potentially could be subject to different quarantine rules dependent on where they enter the UK. And you're talking there about surge testing, etc. Really important that those things are taken up. The vaccine delivery is very crucial too. My own constituency does not have a venue for under 50 vaccinations in it. And that's something that I'm very concerned about. So it's really important that our devolved administrations and the UK government work closely together, as it is a very sensitive time.
OK, let's put some of that to Sir Geoffrey Clifton-Brown, then Conservative MP for the Cotswolds. I mean, there is a lot of talk of late about confused messaging from the government, especially when it comes to the Indian variant and also to travel as well. One thing that has come up today that's interesting is, why is it that 1,000 people a day are flying into the country from India, despite the real worries about the new variant?
Well, if people had listened to the Prime Minister and the Transport Secretary today, the advice is very clear. You should not be travelling to an amber list country unless you have urgent employment reasons or you have urgent family reasons. So these are guidelines. People should use their judgment. Of course, people are still entering this country from India because they have good reason to do so. They will be tested on arrival. They will have to quarantine. They will be tested during that quarantine. We are putting in place the necessary measures. The government, via the Joint Biosecurity Committee, are publishing all the advice. And as soon as we can get countries either off the amber list onto green, hopefully, or if they deteriorate because they're not doing the number of vaccinations or the number of cases is rising, they will, of course, go onto the red list. So this is a dynamic situation. It will change.
And of course, we know there's been a huge amount of criticism about India not being put on the right list quickly enough. We perhaps won't go into that this evening, but is there not an argument to say, look at Australia, look at New Zealand, they've closed their borders completely and they're pretty much COVID-free, certainly free of any Indian variant. Why can't we just do that? Even if it means a few weeks' pain, at least it will solve this problem.
Because we are a much more internationalist country. There are 20,000 people each week that come from Europe for very good employment or family reasons. We cannot hermetically seal this country. It simply isn't possible. All the medicines, all the food, everything else, people who deal with those need to be able to come into this country. So what we have to do is adopt a sensible regime. And I think this traffic light system is sensible and people should abide by the guidelines.
What do you think about that, Rushanara Ali? I mean, do you think it would have been sensible to be much stricter with the borders and not even have this traffic light system at all?
Well, this government keeps pushing out rhetoric about controlling borders, but it seems incapable of controlling borders to keep infections low and keep new variants out. What we need is clarity and professionalism and competence in the government to make sure that everything that is needed is done to ensure new variants don't come. That means proper quarantining, which we called for all through last year. That means making sure that the testing happens. That took many months for the government to get a grip on. Even developing countries, even poor countries, have managed to have a better control of how they manage people who come inside their countries into airports and how they get from the airport to their homes and how they
Sorry to interrupt, but to be fair to the government, the quarantine system and the testing is in place now, isn't it?
But the point is that if the testing is in place, then why is it that we've got infections going through the roof with the Indian variant? Why is it that this government didn't listen to opposition parties, not just my party, but other parties who called for restrictions and countries being put on the appropriate lists and quarantining being put in place appropriately, quickly enough, including with the Indian variant? We saw the same happen with the South African variants and other variants. This government is too slow to act. And what we're having now, what we end up with is proliferation of infections, as we've seen with the second wave, and then we have to lock down the economy. And it costs our country dearly, it costs lives, as we've seen, many of us have lost loved ones because of the incompetence of this government. That includes me. That includes people across our country.
Yeah.
That's why it's so disappointing. And what we need is for the government Jeffrey talks about people just taking the advice and the government being the clear. The government is completely confused, creating confusion, telling people on the one hand.
We're running out of time, and I just want to get a final thought from Wendy. The Prime Minister did say today he doesn't want endless legislation. He wants to move towards people being able to make their own decisions and do the right thing. And isn't that fair enough after months and months of really tough restrictions?
Yeah, but people need guidance about what is the right thing to do. Jeffrey talked about systems being put in place, but the reality is there's been too much of a delay between announcements and then changes coming into force, which have meant that people are struggling to know what the right things to do is. We're talking about people coming in from red countries. I agree that you can't hermetically seal, but by the same token, what we're hearing is of people sitting in airport arrival lounges from red and amber and green countries mixed together. And clearly, that is exactly the kind of breeding ground for this infection to spread. So we want people to get to a place where we can open up the economy, but it doesn't need to be an either or between public health and economy. If you take the right public health decisions, if you give people funding so that they can properly self-isolate, then we will be able to open up the economy. Okay. And the last point I would say is an international it's an international situation. Nobody is safe until everybody's safe, and we absolutely must keep pressing for more work to be done to support developing nations and elsewhere in the world.
So Jeffrey, I'll let you have the final say, if you'd be good enough to keep it brief.
That's exactly the right point. We are all internationally in this problem together. We've all got to fight this pandemic together. It's no good one part of the world being vaccinated and another part not, because that's when variants will arrive. We've got to help other parts of the world. But let's be absolutely clear, we wouldn't even be thinking about opening up the economy or wide-scale travel if this government hadn't taken the right decisions on vaccines. And we've now got well over 70% of the adult population vaccinated. That will enable us to open the economy up on the 21st of June. And if we'd listened to the opposition, we would never be in that position.
OK, we must leave it there. Thank you all for your time. So Jeffrey, Clifton Brown, Wendy Chamberlain, Rushanara Ali, thank you.